Hello everyone, this patient had olecranon displaced comminuted fracture. With that, patient also had radial head displaced fracture and coronoid minimally displaced fracture. So these kind of fractures need to be fixed accurately in order to have a complete range of motion and stability in future. So we are going to keep radial head plating and radial head replacement as well as olecranon plating standby for this case. Intraoperatively, radial head was not reconstructable, so we have decided to do radial head replacement. So as you can see, this is the trial prosthesis, and this is after cementation of the final prosthesis. The diameter of the radial head in this case was 20 millimeter, and we have approached proximal radius and ulna through Boyd approach. It is important to see that we have not overstuffed the radiocapitular compartment, and the joint line is matching that of the ulna. If we do radial head axion in such cases is bound to cause significant instability. After radial head replacement, we are going to pass a suture lasso of number 2 ethibond through the anterior capsule, which is to stabilize the minimally displaced coronoid fracture. We have not yet tied the suture lasso. I have just kept the threads as it is, and then I have applied the olecranon plate and stabilized the olecranon fracture. You can also see that I have used 3 millimeter anchor to repair the annular ligament as well as the ULCL, which is going to provide the ultimate stability in extension too. This is the intra-op range of motion of the elbow. You can see it is quite stable and congruent even in complete extension. The SAG sign is negative. This is the post-operative X-ray. You can see the implant position is quite good, and we hope for good recovery in future for this patient. Thank you.